Do you know that healthcare costs vary so dramatically from country to country? Let's dive into the world of healthcare systems as we learn English with Sopodiva Training Centre in Accra, Ghana. Essentially, a healthcare system is a network of organizations, people, and actions whose primary goal is to promote, restore, or maintain health. It's the beating heart of a country, supplying the lifeblood to its citizens. Yet, it's a complex beast. The cost of this system can vary wildly from one country to another. In some places, healthcare is seen as a fundamental right, with costs shared by the community. In others, it's more of a commodity, with prices determined by market forces. The result? A global patchwork of healthcare costs, from the affordable to the astronomical. The U.S. healthcare system is often compared to those of other countries, but is it really fair to make such comparisons? Let's break it down in the next scene. The United States healthcare system is unique, but how does it really stack up against those of other nations? Let's dive in. The United States operates on a mixed system, combining both private and public funding. Private insurance, often provided through employers, forms the backbone of the system. However, public programs like Medicare and Medicaid also play significant roles, primarily catering to the elderly and low-income groups. In contrast, the United Kingdom operates a predominantly publicly funded system known as the National Health Service, or NHS. Funded through general taxation, the NHS provides most healthcare services free at the point of use. Then there's Canada. Its healthcare system, often referred to as Medicare, is publicly funded and administered on a provincial or territorial basis. It's a system driven by the principle of universal care, aiming to ensure that all residents have reasonable access to medically necessary hospital and physician services without paying out of pocket. Germany, on the other hand, operates a statutory health insurance system. It's a unique blend of public and private sectors where everyone is required to have health insurance, but the delivery of care remains largely in private hands. Each system has its own strengths. The U.S. is known for its medical innovation and has some of the best specialist care in the world. The UK's NHS, with its focus on equality of access, ensures that healthcare is free for all at the point of need. Canada's universal care principle emphasizes accessibility, while Germany's mixed model offers a high degree of patient choice. However, these systems are not without their weaknesses. The US struggles with high costs and unequal access to care. The UK's NHS often grapples with long wait times for certain procedures. Canada's system, while universal, sometimes faces criticism for its lack of coverage for prescription drugs. And in Germany, the division between publicly and privately insured individuals can lead to disparities in access to care. While each system has its pros and cons, it's clear that there are vast differences in how healthcare is approached around the globe. So, what have we learned about the U.S. healthcare system and its international counterparts? We've delved into the intricacies of the healthcare conundrum, and it's clear that the American healthcare system is a complex beast. With its unique blend of public and private funding, the U.S. stands out from the rest of the world. We've seen how this system, while offering a high level of care, can also lead to unequal access and high costs. Comparatively, we've explored how other countries approach this issue, and it's fascinating to see the diversity in their systems. From single-payer systems to insurance-based models, each has its strengths and weaknesses. But a common thread across these countries is the commitment to universal health care, a goal that the U.S. still grapples with. As the USA continue to grapple with the challenges of healthcare, let us endeavor to take care of our English classes. Sopodiva remains your reference, with plus 233 267 092 896. We are just a WhatsApp call away.